I don't know if you guys can hear.
Back.
Monique, are you back?
No, I'm still here. I'm going to turn my camera on so you all can. I don't know if you can see me or
Okay.
not, but
Hey, there we go.
okay, here we are.
We
Good
had
morning.
a glitch. Yeah.
If so, we'll open it up for questions here from the board for sure if they have any from you. What I have is, let's regardless of whether the board decided that they wanted to, if they decided they didn't want to mandate the CE, but maybe wanted to make some sort of awareness statement or video or something just to like help educate. Is that something that you guys have access to, or already have, that could be shared?
So, we don't have anything online in terms of a training video, but there are some resources that are available online that would not be state specific at this point, but there are some national resources that I could share out with you all. As I mentioned, we are actively working on developing a training for healthcare that will be state specific, but we are looking for that to launch sometime next year. And so I could, one, send resources, but also two, once we have developed out some information for the healthcare sector in terms of training, I can also link you all to that at the appropriate time.
Okay, yeah, I mean, that would be great to share some of that. And if you have something that you could share now that would be information we could pass along that people could read or watch, whichever format you have access to, I think would probably be good. I think at the least, I think we should share the information with our colleagues and licensees so that they can have the opportunity to learn more about how maybe they could be of help. I'll open it up. Does anybody have any questions for Monique?
Yes, I've got one. Monique, everybody
Yeah.
wants an office with a view like you've got right there. That's out. That's outstanding.
Well,
Uh,
it's beautiful, but it's very hot. So
uh,
you have to be careful what you ask for.
okay, good.
Yeah.
So this is a tender subject, and I think it's one that everybody here on this board is deeply concerned about, as every American citizen should be. It's just wrong. And there's right and there's wrong, and this is wrong. And so I think as a board, we're going to be very receptive to doing anything that we can to recognize, to help with this. I kind of put this topic out to my staff. We all kind of gather around a table and eat. And so I had assistants, I had hygienists, I have another dentist in my office. And I just kind of said, well, what do you think about this? And I had one hygienist who said, well, from what I know, here's the deal that happens. He says, these people come across the border, and they have a number on them, and they have a name. And when they come in, they'll call that number, and the person's name will, and I know nothing about this. I'm just saying what my hygienist said, trying to get a feel for how we could impact in a positive way to help with this issue. And she said, the person will come and get that person, and she looked at me and she says, taking that person to the dentist is going to be the last thing that person's thinking about, to get exposed or to get caught or anything like that. So I'm just trying to make this real, and I think as a board member, before we kind of put this out for all the dentists and hygienists and assistants and things like this, what could you tell me that would make this issue real, and how can we relate to our staff and to other dentists and say, hey, this is something that you need to do or should do?
Yes, absolutely. I think there exists a number of misconceptions about human trafficking in a lot of our trainings and outreach and presentations that we facilitate across the state. Look to address those things, because I think we have this very Hollywood media informed version of human trafficking. And oftentimes it otherizes other people, and they say that, oh, well, it's not happening to people that I know or people that are not in my community. But we know for certain that it is. The most common form of human trafficking that happens in our state and across the nation is familial trafficking. So I would say, yes, it could happen the way that your dental hygienist stated. That's a possibility. But what we're seeing most commonly is that it's really a lot of parents who are trafficking their children. We see a lot of romantic partners trafficking their partners who they're adults. We also see a lot of trafficking happening in multiple scenarios. It does not have a single face or demographic. We have a curriculum called Traffic Proof SC that we go to middle schools and high schools to talk to youth about it, because the primary demographic for trafficking is going to be our young people, people who are under the age of 18. And so we go into the classrooms and we talk to them about these issues. And more cases than not, we are having kids who are disclosing that I think this has already happened to me. I think this is happening to me. It's happening to someone that I know. And so I think that is the important part of education, is that we then again begin to get new perspective about who it's happening to, what things we should be looking out for, and not to go in assuming that what we heard in the media is the most comprehensive understanding of the issue. We just had a case that was prosecuted last year by our office, and it was a mom who was labor trafficking 3 of her children. And the way that we were able to, the way that the kids were identified was not through DSS or through any formal organization, but it was through one of their teachers who actually reported them to be truant. They were actually truant in their area, actually in the Low Country, if I'm being specific. And they saw that the kids weren't coming to school. And instead of just turning an eye to it or assuming, well, this can't be happening, they actually reported it, and they found that these children had been trafficked for an extended period of time, living in inhumane conditions, while the mom profited from trafficking them by way of a movie theater, having them clean at all hours of the night. And those kids were ranged from elementary school to high school. So I think there is no singular face for victims. There is no singular face for those who can perpetrate. And it is important for all of us, if we say we want to protect kids, that we all are aware of what it looks like, how it presents, and what we can do to stop it and to save, and not save, but to support our families and our victims from being exploited by people who don't mean them well.
Thank you. Andrews.
McDonald, thank you for speaking with us. In order for, I think, this board to really support this, there'd need to be some very specific dental component to this. And if you're not going to do that, I wouldn't be very supportive of this. But that being said, I think it's reasonable to have this as part of our training. The frequency I'd have to think about, but if you're developing something, if you do not develop a specific dental component, I think you're missing an opportunity for this board to support it.
Yeah, absolutely. One of the things that we are intent on doing, the task force, is making sure we have sector-specific training. We are beyond the place of providing just a generalized view of human trafficking, because it looks a lot different in different sectors. Right now, we are focusing on healthcare, which does include the dental professionals. And so if you are interested in doing that, we will certainly be developing and targeting the dental profession regardless, because we see that as healthcare as an umbrella term for that. Even with our law enforcement trainings, we are looking at it not just by sector, but just like different positions within that sector. We're looking at victim advocates, we're looking at specialized agents, we're looking at U.S. Attorney's Office. We're just trying to make sure that we are able to target every sector specifically. So that wouldn't be a concern for me. There are other states who are also venturing into this. You'll find that if you learn more, as you continue to learn more about the task force, you'll find that South Carolina is on the cutting edge of this work. We have states reaching out to us from all over the nation, asking us how we're doing the work that we're doing, and we have been quite successful with it. And so I don't think it would be a negative thing to include this. I do, as I mentioned earlier, see it as a proactive measure because we likely will return to look at legislation to see if we can include more groups. And I think if there's an opportunity for us to include it on the front end, that is a lot easier to implement as opposed to having to go back and implement it later. So I would just use that as a consideration as well. And I'm always happy to come back. Sometimes when providing human trafficking presentations and trainings, it's sometimes helpful to, at least for you all, to have a human trafficking presentation prior to, just so you better understand the issue and you might be able to better see how this issue overlaps and is specific to the dental profession.
Thank you, Monique.
Ms. Garber, may I ask a question? This is Michael
Yeah.
from Columbia, South Carolina. I'm sorry. Are you partnering with SCADVASA, the South Carolina Coalition Against Domestic Violence and Sexual Assault, or does your agency use other resources?
So the state task force partners with everyone that's in the anti-violence field. SCADVASA specifically is one of our appointed non-governmental agencies. So SCVAN, which is the South Carolina Victims Assistance Network, alongside SCADVASA, are the appointed organizations for the task force. So we do partner with them. We actually partner with many state agencies, especially a lot of child service state agencies, DSS, DJJ, Department of Mental Health, substance abuse. We are integrated into, if I can't, every facet of the work across the state, regionally as well as nationally. We have partnerships across the nation. Right now, we're working with Heal Trafficking, which is a national and international healthcare systems group that's also working at the national level to ensure that they are helping develop systems that can respond to trafficking from the healthcare sector. We also have a certification program that works with specialized human trafficking organizations. So SCADVASA mostly focuses on domestic violence and sexual assault. So we also work alongside programs that work solely with human trafficking victims. So yeah, there is no organization that I can think of that we haven't had an opportunity to partner with. And if I'm able to come back to share more, I could share that into a longer presentation, or you all could join some of the trainings that we have that we share out on our task force listserv if you want to learn more.
Tom McDonald again. Are you already in the medical schools and dental schools in the state? Do you have a program for them?
Yeah, so we have not done that just yet. So just to give a little background, so the South Carolina Human Trafficking Task Force was not funded at its inception. We were recently funded in 2022. In 2014, we were able to develop our state plan, which addressed healthcare. And now we actually have the funding to implement some of those items in the state plan, and healthcare has been one of our top priorities because we know that majority of victims who are identified have encountered the healthcare system by way of dentist or hospital or emergency room at some point or another. So this is the area that we chose to prioritize alongside working with law enforcement or court systems, is also working with schools. So we do have a healthcare subcommittee as well. And so there is an opportunity for our healthcare subcommittee as well as the higher education subcommittee to engage with those groups. But that would be after we develop the training. So we're actively working on that now. And so this time next year, we hope to have a finalized training, which we will be engaging with those schools just to kind of get ahead of the legislative requirements, but also to inform them of the kinds of circumstances they may encounter in the field.
I would highly recommend that you do that. I think that's where you're going to get a lot more bang for your buck.
Yeah. Well, it's a delicate balance because, you want to make sure people have the training beforehand, but there are already people who were in the profession who also need the training. And this is a very specialized group. So we have to kind of tackle it from both ends. And I think the legislation does a great job at requiring it of those who are entering into the field. But I think there is certainly an opportunity for us to capture those prior to going into the field too. So thank you for pointing that out.
Hi, Ms. Garvin. This is Amy Natoli, Charleston. I was wondering if you could just give us a brief summary or overview of the statistics for South Carolina for human trafficking, and also like the hot spots, like, upstate versus low country versus Grand Strand, just both types of
Wow.
trafficking, please. Thank you.
Absolutely. So I'm always very hesitant to answer this question because I always feel like the data is constantly changing, and the numbers that we are sharing are generally underrepresented because, again, that has to grow over time with education and awareness. But what I can tell you is that in South Carolina, just last year, our South Carolina Law Enforcement Division opened 315 tips, investigated 315 tips for human trafficking. Majority of those were for sex trafficking. We had 270 for sex trafficking and about 25 for labor. And then we also had some victims who were identified as having both sex and labor trafficking victimization. We know that in South Carolina, just last year, we had 42 out of the 46 counties in South Carolina who reported or had at least one investigative case in their area. So we know that it's happening across the nation. It is not specific across the state. It is not specific to one county or another. And we also know that there is a disproportionate number of youth who have been identified and who have been trafficked. We had 234 minors and 89 adults who were identified last year. And then in terms of where of the regional allocation of those victims, I'm going to look at my chart. Okay, so we actually had 95 in the upstate. We had 76 in the Midlands, 42 in the PD, and then we had 100 in the Low Country. So the Low Country and the upstate areas are the ones who were the two areas of our state that had the most cases last year. But that doesn't necessarily mean that is where trafficking is happening the most. It's just where it's been identified. We have people on the ground who are able to support training efforts and resources to help people identify them. So I like to make sure I'm being balanced in that and sharing that data because I don't want people to assume that, oh, it's only happening in the upstate, or it's only happening in Low Country. What we do know is happening in majority of the counties in our state. And we know that we are seeing more identification in the upstate and the Low Country as well.
Monique, thank you for your time today. We appreciate that very much, for making out time for us today. And if we have any further follow-up or questions, we will be reaching out to you. Best of luck in all your work that you're doing.
Yes, absolutely. I know I gave you all a lot of information, so I'm happy to compile it into maybe a easier way to digest it. But thank you all for the invitation. Thank you all for being proactive and ensuring that we're helping to keep our youth and our adults in our state safe. And if you ever need anything, please do not hesitate to reach out.
Thanks so much.
Can I ask one thing? So,
Yes,
Monique,
of
can
course.
you, my name is Kevin Covington, I'm from Greenville. Could you keep our board updated on what you're doing on the medical side?
Yes, absolutely. The LOR and I have been talking about ways to message a lot of this information because it is a little bit dense. So we will be working together to communicate the happenings of the task force as well as the other boards who are currently involved. And I'm sure that Bob or someone from LOR will be important and will be great advocates for how we communicate that information out. So yes, absolutely.
Yeah, thank you. Amy or Bob would be good resources for that. Thank you.
Perfect. All right. Thank you all. I'm headed to a task force meeting. If you want to join, we are meeting at 10 o'clock if you're out of this meeting. If not, we will see you all hopefully at our next meeting.
Thanks, Monique.
Have a great day.
Bye-bye.
Bye.
All right. So moving on to the next section, we're going to be doing the staff reports, but we need a motion to go into closed session for that.
Motion to go into closed session, Covington.
All in favor? Aye. All opposed? All right, we're in closed session.
Oh,
Oh, yeah.
to answer Dr. Michael's question specifically about the age of the cases, the 2024 cases. 0. Ms. Smith looked it up while we were in the meeting, and there are none.
Yes. That's a big, I was a little concerned about that, so thank you for letting us know.
One thing, since we're on the topic, Ashley contacted me about in-house reviewers to assist Dr. Coombs. We reached out to Dr. Bumgardner yesterday to see if he would be willing to be an in-house reviewer, and he said he would be honored. So if we could get a motion by the board to approve Dr. Bumgardner as an in-house reviewer for the board.
I'll make that motion, Copeland.
Yeah. Charles Bumgarner.
Only one Bumgardner as far as this board is concerned.
So we want a motion to approve him, say that one more time, as a,
In-house reviewer.
As an in-house reviewer.
To assist OIE and.
I'll make that motion, Copeland.
second? Second, Reagan? All in favor?
Aye.
All opposed? Okay. Thanks, Charles. I know you're listening. All right, Amy, if you want to do the board executive report?
For sure. I don't have a whole lot for you
you-
today.
Amy, I can do the quick ODC report.
Oh, so sorry.
Sorry.
That's fine. We get mixed up with the OIE. I've also got the
Well, do
Office
we
of
need to go?
Disciplinary Council report.
I missed that. Do we need to go back into
It's
closed
just
session?
a numbers report, so I think we
Okay,
can do
I
it
think
in
we're
open
okay?
session. Yeah.
Okay, all right.
We currently have 69 open cases, 19 that are pending hearing or agreement, none that are pending closure. We've closed 5, and there are none currently on appeal. Just for your information.
Thank you.
No vote. Thank you.
Okay, Amy.
And I mostly also just have things for your information. I wanted to give you some of your licensing stats since your last board meeting. Currently, we have 4,021 licensed dentists in the state. Of those, 866 are specialists as well. There are 4,603 licensed hygienists, and these are active, by the way, with 2,446 having also their infiltration anesthesia. We have 44 dental instructors, 2 ortho techs, 122 dental techs. Since January 1st of this year, we have issued 144 new general dentist licenses, 24 new dental specialty licenses, which may or may not be in that 144, 141 new dental hygienists, of which 1 also has the infiltration anesthesia, and 4 dental instructors. There have also been 27 sedation permits. The average current processing time, and that's since April 1st of this year, is 19.05 days total, with 1.32 of those days being staff days and 17.72 being applicant days. And that means that our clock starts when the application comes in, and when we ask for something of the applicant, our clock stops, and that goes on the applicant clock until we get whatever that is. So usually from the time we get an application till the time, or average from the time we get an application to the time it is issued is under 20 days. And that is really all I have for you. I will remind everybody that your licensing renewal period per statute starts on or around October 15th, which is before your next board meeting. And with that, I like to remind people, because it is very confusing to many people. It took me a while to get my head around it as well. You have a progressive fee schedule that says if you don't renew your license by December 31st, it doubles. If you don't renew it by February 1st, $5 a day is added to that doubled fee, and then your licenses expire on March 1st. So just a reminder, and a reminder to anybody's watching, please utilize CE Broker because you are required to do that. And that is all I have.
Thank you, Amy.
You're welcome.
Yeah.
Questions, please? Amy, so just double checking, we have a little bit more hygienists than dentists in the state? A little bit more.
Yes, we have, let's see, about a little over 400 more hygienists.
And,
Or excuse me, we have about 600 more
right,
hygienists, sorry.
Right. And then when you say new dentists, licensees and new hygienists, those aren't necessarily new dentists, but they're newly applied to this state?
Yes, new to South Carolina. So that's not going to include reinstatements. You do have some reinstatements. I think you've only had maybe 10 period. That includes dental hygienists in there as well. And I think there's even been a tech that's in that time. But that is a new application to the state of South Carolina. Some of those will be licensed and practicing in other states. Some will be right out of school, like people graduated in May, so we've had a lot of applications come in over the past month or so for new graduates with dental hygiene and dentistry.
And that kind of triggers my question, because I'm wondering, aren't most of the hygiene students that are graduating, aren't they infiltration certified? Aren't the hygiene programs in the state doing infiltration?
They do, but not everyone goes through the infiltration anesthesia certification.
They'll take the class, but they may or may not take their.
Oh, okay. Okay, and then we have the new renewal cycle coming up, so we have a new application coming out for licensing dentists?
No,
in the
we
fall?
don't have a new application for dentists. Nothing's changed, it's just the renewal.
Right. I guess that's kind of part of my question. So there's a new application, not a new application. There's an application coming out for renewal this year,
For
correct?
renewal, yes,
Okay.
yes.
And my question is, I think that you've been working with some people trying to have the language changed a little bit on the application about substance abuse history. Has any of that become useful
I
information?
will refer to Mr. Horner, but I believe we already updated our renewals several years ago.
The renewals are accurate with the updated questions regarding mental health and substance abuse
what I
history.
meant.
The initial applications have not been updated probably since before Amy started. So that is on our list to make those questions the same as they are on the renewals, but we did the renewals first.
Thank you.
Sorry.
Thank you, Amy.
Sure.
All right, we'll move on to new business. We've got the AADB 2026 mid-year meeting report.
That is in your package for your information. I don't know, let's see, I believe Dr. Michael and Ms. McAllister attended, if you have questions for either of them.
Yeah, Dr. Brown actually went too, I think.
Yes, she did.
Yeah.
She
She's gone, but yeah.
left, I was going to say, I don't think she'll
Still
have anything
going
to say.
strong, I know.
That's right.
Dr. Michael, did you want to have any comments on the AADB mid-year meeting? Did you have anything you wanted to share with us?
Well, Norma was there for the whole thing. I had to leave her a little bit early due to a family emergency. I will say, as usual, it's so well run. There's lots of information, lots of discussion across all the states. The issues kind of surprise you. I'll just throw out the most interesting one from this time was a dentist who was fined because he was shooting squirrels from the window of his office. That wasn't the problem. The problem was he was bringing the squirrels in and lining them up on the windowsill. And so a staff member reported that.
Sorry.
Man, that is awesome. Thank you. South Carolina, I assume.
That was in Oklahoma.
Okay.
Oklahoma always has the best stories. I think they're the ones that are willing to share.
The stories they share are often wilder than anything I've ever heard, so it may be very unique to Oklahoma.
Norma, are there any nuggets you got that you wanted to share?
I just want all for allowing me to attend. I did meet some of the partners in regulations from other states. That was quite interesting. And also the stories that they shared from Oklahoma. And the investigation, that was also interesting as well. One of the things that I do know that I appreciate is that some of the states actually have stakeholders meetings and conferences with all the stakeholders that are involved in the regulatory matters, which would include their associations. I don't know, with the board members, et cetera, I don't know if that is something that South Carolina could do, but it is quite interesting. It was quite interesting.
So mostly when you say stakeholders, this is the dental association and the board or members of the board getting together for a meeting, and this is like on record, I guess, that they met, something like that? Okay.
Yes, and sometimes they include other stakeholders as well. They would identify I guess what I'm understanding, they identify the important stakeholders within their state.
Sure.
And then they have a yearly meeting. I don't know, again, if that's something that South Carolina is able to do or will do, but it was quite interesting to find that out.
Do you remember one or two of those states that did that?
I want to say it was either Oklahoma or New Jersey.
Okay. But if you could send me an email on maybe a couple that did that, that'd be great.
Okay.
Yeah,
Okay,
thank you.
I will.
Our regulatory process is quite different from some states. A lot of states do it through rulemaking, which goes through the board but does not go through the legislative process. We have discussions in open meetings in which the associations attend. So I did want to throw that in there. It is quite different in some states the way they do things than the way we do. So we do have, I think, a heartier checks and balances, if you will. Some states don't, I don't want to say they don't have that, but the
Yeah.
board makes the rules without legislative, sometimes, oversight when it comes to regs.
Well, I think, yeah, and that's a good point, Amy. I mean, it's kind of nice that we do get Mark and Phil showing up for all of our meetings who represent the South Carolina Dental Association. They're here every single meeting, and keep everybody informed. And I think that's a really good communication and working relationship. So,
I believe the Medical University of South Carolina live streams all of our meetings, so they're, because they will sometimes send me their thoughts on a
good.
discussion. And as you know, with the recent update to the instructor license, that was a stakeholder being
Yes.
MUSC actively, and I believe also the SCDA helped with that, and the SCDA. So those were two outside of the board partnering together for a legislative matter.
Yeah, they did a good job with that. Yeah.
May I add one more story from the meeting? Sorry.
Please, that would be great.
This was a person I was sitting with for a lot of the meeting, and he's a denturist. He's on a board from Montana, and he's a denturist, which I've never really met a denturist. I've only read. They make dentures. That's all they do. They're not a dentist. They're a technician, but more than that, because they actually interact with the patient to make the dentures. And there are rules about that. It's interesting. But the interesting thing was when we had the squirrel story, I found out that in his section of Montana, they don't have trees, so they don't have squirrels. So they have what they call ground squirrels, which are probably more like what we think of like a groundhog.
Oh, wow. Well, the patients in my office would be very bored then in that state because we got all these glass windows and we have bird feeders, which of course turn into squirrel feeders, in our state. All right. So next up is the appointment of triage dentists. Was that Dr. Bumgarner?
Yes, that, you've already done that.
We
That
did
was
that,
Dr.
okay.
Bumgarner, yes.
That-
And
and
that's
then-
Dr. Charles Bumgarner, not
Yes.
Dr. George.
Yeah, yes. And then travel requests.
Okay, we've got several travel requests for you. The first one is the 2026, that's the credits, the Central Regional Dental Testing Services Annual Meeting and Workshop. That's in Omaha again this year, August 28th through 29th. The credits does pay a portion of that trip. They pay, I believe, the hotel and the airfare, and then the agency or the board would cover the rest of the fees. So that's not 100% on the board for covering, but there is that. And of course, Dr. Copeland is still very kindly serving on the steering committee. I know that's a lot more work maybe than he bargained for. Thank you, Dr. Copeland. Yeah, and Ms. Barbary
Thank you, Brent.
also is very involved, I believe, with credits still. But that is open to all board members as well as me.
Okay, so we need to approve travel for 2 board members and yourself?
At the very
Any board
least.
members
Any board member.
that would want to go?
Who would want to go? And if more than the 2 want to go, if you'll get that in the motion, and I can always submit it to see. I think credits will cover everybody, but the agency might not.
All right, do we have a motion to approve travel for all board members and Amy to the credits meeting?
McDonald, I move that we approve travel for Amy Holloman and any and all board members that want to attend the credits meeting.
Second.
Second, Natoli.
Favor? Aye. All opposed? All right, motion passes.
And then I have, the next three are all related, but I'm going to do them one by one. The first is the American Association of Dental Board Administrators Annual Meeting, which will be at the Gaylord National Resort and Convention Center in Oxon Hill, Maryland. I think the dates on that will be October 14th and 15th. We don't have a agenda for that yet, but that's usually when that will be. So the first is for me to attend that, where I sit in a room with my counterparts from other states and learn a lot of great stories from Oklahoma. We should all be Jeopardy ready if Oklahoma is ever a
So we need to approve you going to this one,
need
correct?
for that one. Mhm.
All right, can I have a motion for that?
McDonald, I move that Ms. Holloman be approved to attend the American Association of Dental Board Administrators Annual Meeting.
Second, Rodelsberger.
All in favor? Aye. All opposed?
Okay, the next is the travel requests for the American Board of Dental Examiners annual meeting. The AADE is now I think the sole provider of ADEX. And that one, they cover the travel for the hotel, I think for 2 nights in the hotel, and airfare, and I believe some other parts for me and any board member who'd want to go. And I believe also they would cover your general counsel, but that would be one that the agency would only have to cover a portion of, and that is open to all the board members as well.
Do we know what dates that is yet?
That, I believe, is October 15th and 16th.
Okay, do we have a motion?
McDonald, I move that we approve travel for the executive director, advice council, and any board member that wants to attend the American Board of Dental Examiners Annual Meeting.
Dickey, second.
All in favor? All opposed? Motion passes.
Third one is for the American Association of Dental Board annual meeting, and that I do know is October 17th and 18th. They're all right back to back, and they're on the same place. And that one, the agency is fully responsible for travel, et cetera. So if someone were to go to the AADE meeting, for instance, their airfare would be covered, but the hotel would be paid for by the board, registration fees, et cetera. And that, again, is open to myself, advice council, and any board member who wants to go.
Where is that meeting this year?
It's in Oxon, Maryland, Oxon Hill, Maryland, which they call it, they say DC, so I'm guessing it's DC adjacent. I believe it's on the harbor in
Yeah,
Maryland.
that's definitely a busy weekend for conferences. That's when our Southern Society Orthodontist meeting is as well. It's a busy weekend. Everything always seems to happen in 1 or 2 weekends.
Yes,
in the
they
fall,
do.
same thing in the spring. Okay, do we have a motion for that?
McDonald, I move that we approve travel for the executive director, advice council, and any and all board members that want to attend the American Association of Dental Boards Annual Meeting.
Second, Rodelsberger.
All in favor? All opposed? All right, motion passes.
Yeah. Erwin, I think you're next on the agenda.
Okay.
Yes, I'm so sorry.
Where do I go? Okay.
Mr. President, can we get a 5-minute break?
Sure. We'll take a 5-minute break. Make it 5 minutes, though. We're timing. Call to order, and this is the matter of Kyle John Roth. The purpose of this hearing is to determine whether Dr. Kyle John Roth should be considered for reinstatement of his South Carolina general dentist license. Does any board member have a reason to recuse him or herself from this matter? All right, we do have a quorum of the board. Everyone is reminded that these proceedings are being recorded and that all witnesses must be sworn in before they testify. Any remarks should be directed to the president. My name is Dr. K. Brett Reagan, president of the South Carolina Dental Board. The attorney assigned to advise us during the hearing is Bob Horner, Office of Advice Counsel with LLR. And this hearing will be held in accordance with provisions of the South Carolina Administrative Procedures Act and the statutes and regulations of the South Carolina Board of Dentistry. Ms. Holloman, did board members receive the complete application package?
Yes, they did.
What questions did staff have concerning this application?
Dr. Roth has applied for reinstatement of his license, and per Dr. Roth, he has not seen patients since late 2019. Section 40-15170 says relicensure after an absence of 6 years may be discretion of the board upon proof of high professional fitness and moral character. We've not seen a dentist re-enter after more than 6 years in a very long time, so we weren't sure what to do with it. So he's coming today to find out what he needs to do.
Okay. And Doctor, hold on just a second, Doc. We're going to get to you. We're going to get to you, okay?
Yep, perfect.
So, Dr. Roth, are you represented by counsel?
No, not at all.
Okay, and you understand that you do have the right to be represented by counsel if you choose?
Sir.
Okay. And you're electing to waive that right and represent yourself?
Yes, sir.
Okay, and then you have the right to a 30-day notice, and you did receive that notice of appearance dated May 18th, 2026 by certified mail, is that correct?
Yes.
Okay. And then, do you have any witnesses that you intend to call?
No,
Okay.
not at all.
So, and I know that we got to swear him in, right, Bob? Yeah, so the court board needs to swear you in.
You'll raise your right hand for me, please. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God? Thank you, sir.
Okay. Now, is there anything that you'd like to tell the board in regards to your application?
Sure. As I had a South Carolina license, I was living in North Carolina, and for the last 25 years, I've had a house in South Carolina, and I would come down, weekends and during the summer sometimes, and I really had zero intention. I said, maybe I'll open a practice here at some point. I got my license, and I just let it expire because I figured I was never going to do it. And as of this year, I had a partner that talked me into opening a hygiene-only place in Myrtle Beach with access to care to people that did not have dental insurance. There's a huge service industry group there, and there's a lot of retirees there. So I would bet 90% of the town has no access to care for getting just for getting simple cleaning, and so as a result, they don't go to the dentist at all. So we made a price point that we were able to see people. And as I should have known, these people haven't been to the dentist in a long time. They come in, and there's a lot more issues than just getting their teeth cleaned. They've got a lot of disease in there, and we're just referring all of that out, okay? But it became apparent to me that it's supervised by, there's a dentist there every day, just checking hygiene, basically. And we are going to start actually doing some procedures. But I think the biggest problem is they don't want to do surgical procedures. I had 36 practices over the last 25 years, and most of what I enjoyed doing was surgery. I worked mentoring the new grads that would come to work in our practice. I would teach them to do surgery. I did a lot of it myself. I retired from, I got away from the handpiece about COVID time, and I just said, I moved full-time to Myrtle Beach, and I said, I don't think I'm going to be doing it anymore. But if you need me here and there, I'll come in, and that's what I do occasionally, but it's been a while. I went last week, actually, and to my Goldsboro, North Carolina practice, and I did quite a bit of surgery. I really loved it. I said, I would love to return to this. I would love to be able to help out the part of South Carolina, Myrtle Beach, that they don't have Medicaid, but they're not hooked up with a major company providing insurance. And fee-for-service rates for them are ridiculously high in some cases, okay? So I said, I'd be glad to do this. I'll give it a try. If it doesn't work, it doesn't work, but I would love to reinstate my license if at all possible. It's been active in North Carolina this whole time. Ever since I retired from the handpiece, I've been very, very active in other ways. I teach continuing education. I speak to dental students across the country. I have one of the largest transition companies when an older doctor is ready to retire and somebody new take over, I help them out. So I've not been away from dentistry. I've just been away from the handpiece. And I'm just asking to be reinstated, not to be an everyday employee. I just really want to do some surgery to get people out of pain, take people out of a disease situation and help them out at a low price point. And that's what I'm asking for a reinstatement for.
Okay. Do board members have any questions for Dr. Roth?
I do. Hey, Tom McDonald. So help me out. You've been practicing. You practiced last week.
Well,
what's our issue?
It's once in a great while I'll go and fill in for people. And it's been years, though. It truly has been years. It's probably, I don't remember anything after COVID started. I don't remember going, I don't have any pictures or any, documentation of it. So truly, it could be as much as 6 years. But I will tell you this, that once I got back in the chair, I was a little jittery for the first patient, but after the first one, I felt like it was truly like riding a bike, and I took teeth out all day long, and I loved it. And
Do you have a current license in North Carolina?
absolutely,
Okay.
yeah.
But tell me, I saw in here that it's like a semi-retired status. Can you explain that?
In North Carolina, they require 2 continuing education credits per year, one for opiates and one for CPR. So I've kept up with that, but I've gone to classes throughout the year. Because of my transition company, I'm constantly trying to be around dentists in order to work with them and help them transition. So I go to classes. I don't even pick up the certificate or anything because I don't need it. But I'm taking business classes. I'm taking airway classes, but I haven't been practicing with my hands really, literally in 6 years. And I have no intention of doing composite fillings again. I don't want to.
Let me interrupt you just
Yeah.
real quick. So when you say you've done these CE courses and you don't have the credit because you didn't need it, you mean for your North Carolina status license,
I can
you
work
only need 2 continuing
two per
for this
year.
semi-retired status? Which we don't have something like that in,
Well, I know.
in our
It's-
state.
so I had to go take all of the classes here.
Yeah, okay. Just
so
making sure you know that you will need them for South Carolina.
Oh, I've got no problem with
Okay.
that. Because like I said, I go to these classes now. And in fact, I took more than I should because I didn't understand. You can't sign up for CE broker unless you're a licensed South Carolina dentist. And so I took a lot of classes at the South Carolina Dental Association meeting. I spent the whole weekend there and didn't realize that some of those were sort of business management related classes and not specific procedures, and they didn't count. So I ended up taking well over the limit. I have no problem with going to classes. I've got no problem with, even if you say no, it's not going, it's going to hurt my feelings a little bit because I really want to help the people of Myrtle Beach. But it's totally in your hands. You know, it is what it is. I did take the time off, but I've been very involved.
So when you did your, I guess your license lapse in North Carolina? And
Never lapsed in North
never
Carolina.
lapsed,
Ever.
okay. So you just moved it to a semi-retired status.
Right. And I could work up to 25 hours per week.
Okay, gotcha.
I have a couple questions, please. Just looking at the statement that we have from you, it says that you stopped treating patients in 2016, but Ms. Holloman presented information that was 2019.
Yeah,
I'm wondering
I've
about
even
that.
got pictures. You know, I went through and I said, well, let me look and see. I've actually got date stamped photos going to as far as 2019. But it was more of filling in between 2016, 2019. I worked less than 20 hours a week, and I'd go fill in for a day or, you know, a day here, a day there. We had several practices at the time, and we were fully loaded with associates, but if people were out, they needed some help, I'd go do it. Plus, I did surgery for fun. I mean, I really, really enjoy it. I don't do complicated surgeries anymore. I'm not doing full bony impaction, horizontal bony impactions. I'm doing the easy stuff now. I don't want to do anything to put myself in trouble. You know, I don't want to do any really risky stuff. I'm doing the easy stuff now.
And you're a general dentist, not an oral surgeon, correct?
Correct.
And you had also, besides the developing the new dentist, you also had a few office-based dental assisting programs in North Carolina?
Yeah, I have 3 of them that I'm not involved in. I'm an investor in, and I have very little involvement with them. Correct.
And when did you start your retired license in North Carolina?
Some 2019, I guess. I don't know.
Sorry, there's just one more question. So when you started that retired license, then you basically stopped taking CE for the most part? You only took the 2 requirements in North Carolina?
No, I took CE all the time, just to
Management, practice management
current, to keep up with dentists, to meet dentists, just to be there to meet dentists, to help them with transitions, because that's my company now.
Right, I'm sorry, I guess I meant, it sounded like you said you mostly just took management classes after that, except for the requirements in
No,
North
I
Carolina?
took whatever courses that I thought I'd enjoy. There were management courses. There were courses on, you know, like I said, airway course. There's surgery courses, just sitting through the course and learning, but, you know, just going, okay, I'm probably never going to be using this stuff again. Never collected certificates or anything. And I'm actually PACE certified AGD to give CE courses now. So we've just started doing that.
Thank you.
Yeah, question, Andrews. Welcome to South Carolina,
Thank you very much.
Myrtle Beach. Kyle, and I may have missed this looking through all the stuff. I'm kind of trying to work through some recent cataract surgery. Do you have your federal DEA license?
I do. I took that 8-hour course for to maintain the DEA license, correct.
Gotcha. Thank you.
Amy Natoli, I was wondering if you could describe the dental hygiene only office, like the procedures. Do you keep perio in-house? How do you refer out?
For scaling root planning, they'll do it if they feel it's doable. You know, they'll refer to a periodontist if it's too much. You know, and some of them are too much, but they like a good challenge, and they'll keep it in-house as much as they want. We give, you know, we will, between the doctor and the hygienist, if they feel like it's something they can handle, they'll keep it.
Currently, how many dentists are covering the exams?
There's only one. It's a brand new business, and it's moving very slowly. Another reason, you know, truly another reason for even doing other procedures other than covering the disease. I mean, we're literally referring everything out, and you can't run a business just on hygiene only. And unless you've got a full office full of people in the chairs, it's financially, I got roped into this by a non-dental guy. He's a business guy, and South Carolina is one of those places where you can own a dental practice without being a dentist. He's like, oh, you're going to be perfect for this, and it's turned out to be a real challenge, but it's very rewarding, and we have a lot of people coming to us, thanking us, saying that, the last time I paid between an X-ray, an exam, and a pro fee, they paid $350, and we charge $99. So we're reaching a lot of people that haven't been to the dentist in 10 years, So.
I think you said what we've all been thinking. You can't do a hygiene-only practice.
It's
only
if
but
you
yet
had
you
enough
opened a
volume.
hygiene-only practice.
Right,
So
right.
now you're finding out that's probably not working out so hot.
It's
And
not.
now it looks like we want to just transition that to a regular dental office.
I honestly, I was thinking that the whole time, that it's unless you have a lot of butts in the chair, it's not feasible. And but it is what it is. It's financially, it's going to make sense for us, but also it's the only way we can move forward. And when we are going to be doing other procedures, we are doing like a PPO schedule. So it's going to be a very big discount compared to fee-for-service prices.
You have the facility for that? I mean, you've got a place to put the chair, or
We have 8 chairs, and we're actually going to move one chair out and put a pan in there. So it's doable.
I just want to go into the modern times. So you're doing $99 for exam cleaning and x-rays?
Yes.
Hygienists are hygienists, registered dental hygienists?
$52 an hour, yes.
Yeah. Okay. Yeah.
The dentist, the supervising dentist charges $800 a day. So you can see that, unless I think my partner really thought when he put 9 chairs in, he said, we're going to have so many people that it's going to cover the cost. And we're both in a pretty good financial position where it's not going to kill us one way or the other. And it is good to be in this position because I feel like I can truly give back. And, we give away a lot of dentistry there. So people that can't afford it, we just take care of them. And that's the way I've always done it, to a fault probably. But we enjoy what we do and super passionate about what I do. And I'll probably do this to the day I die, Maybe not in South Carolina, but somewhere.
Anybody else have any further questions from the board? Okay. Dr. Roth, is there any additional relevant evidence you want us to consider?
Yeah, I was, just a couple little things that might not matter, but I was an adjunct professor at UNC Chapel Hill in the prosthodontic department for years. One of the things, we had 36 practices over the years, and we've never had a board complaint ever in those 36, in all 25 years, 36 practices. I've never seen a board before, It's, we've behaved ourselves, we highly train our doctors. They run very supervised, and it runs like a well-oiled machine. I'm proud of what we've accomplished over the years, and I would love to be able to serve the people of Myrtle Beach and with your.
Okay. Thank you. Thank you, Dr. Roth. Your case has been submitted, and the board will take this up in executive session, which we will go into at the end of the meeting, which is momentarily. And you may wait until such time as a decision is announced, or the board staff will contact you with our decision in this matter. So our decision will be more fully reflected in an order drafted by advice council and served on you. Okay?
Perfect. Thank you.
Thank you. All right. Do we have a motion to go into executive session for legal advice?
Motion, Andrews.
Second, Dickey.
Favor?
Aye.
All opposed? All right, motion passes. Going